A lot of people don't understand where my concern lies and why, after almost 6 years, I'm still talking about COVID. Is it not behind us? Well, sadly, it isn't. And part of what drives that analysis is this understanding of the COVID storm. A lot of people will argue about COVID being dangerous, which it is. A lot of people will argue about vaccination being dangerous, and in some cases, it can be a problem. But very few people understand the question about what happens when you mix the two together. In a vaccine primed population with ongoing circulation of this pathogen, what in the world happens to the pathophysiology? That's what I call the COVID storm, spike triggered autoimmune response mechanism, a storm. And this is what I've been talking about for years now. And as I pointed out on many occasions, when you understand this principle, you will realize why some of the trajectories that I have predicted from 2023 are likely to occur. It's just that they don't happen suddenly. And when we look here at the trajectory, and this is an analysis that I did some time ago, looking at this is essential hypertension, and you can see pre pandemic, flattened here, and then this acceleration. And this is the case across multiple conditions. And this is what I'll be focused on in this next presentation, the rising heart crisis, why cardiovascular disease is surging. This is based on the prediction of the science. And this is what I mean is that when you understand what is going on, you can then predict what is likely to happen. So, what I'll be talking about here, or what I'll be sharing, is an interesting discussion that I had in the past few months with Joachim Gerlach. And he has been working at looking at solutions for spike proteins. And they do have a product that is quite unique in terms of being able to get it out of immune cells. And for anyone who has been following me, the big challenge that we have is that once it is stuck in immune cells, it drives inflammatory processes. And without getting it out, you're likely to have this inflammation continue long term. So here is a short bit, and I'll interrupt it at some of the points because I'm trying to capture some of my ideas with this. But as I said, this was a recording with him that we did some time ago. That's available on their site at Molecusan. And I thought that this would be quite relevant for you to understand what I'll be talking about in the upcoming few days. So let's listen to what he had to say, and I'll jump in and out of the conversation.
So let's go into the most prevalent disorders that can come from this spike persistence is the cardiovascular disorders. And that's actually the system that connects all our organ parts. So it is our main focus. What could we see here? This is a mix of different databases that we put together. And you can see myocarditis has had a strong peak and is now coming down again. But myocardial infarction in young adults was really like peaking in 2021. And now it's even in a so-called negative terrain. And strokes, they are continuously on a very high level, 10% more than compared to 2019 on average. So that is what we see in the cardiovascular metadata. And here we have something.
I'm going to pause that here just a moment because I want to highlight this point very much because this is also what we've been finding when we look at what has been happening, certainly with myocarditis. When you looked at the data from the UK and you looked at the timing, you had a surge, and this is what it would look like here. You had a surge in 2021 going up. It seemed to flatten, but actually it continued to accelerate into 2025. And these were hospital completed episodes. So these are people who are admitted, not necessarily including those who had subclinical disease. And this is what they call an accelerating rise. So this is real, and the signal is there. And it is something that can't really be completely ignored. And this is the challenge. How do we push the scientific community to get on with this research? Let's listen to some more from Joachim.
Incredible. Dr. Jaeger contacted me like a month ago, and she said, my patients seem to fall apart. The elastic tissue, the elastic layers in the vasculature and in other organ parts were kind of degraded. And so the soft tissues that contain collagen, elastin, and other elastic materials are being attacked by the spike and or other, we get to that later, and some of the immune cells. And look at this here, from 2,500 hospital cases for heart valve diagnosis, an uptick to almost 9,000 over the years now. Yeah, so this is a clear indication that something is going on in the elastin and in the lamina and in the soft tissues of the cardiovascular system. So we should give that more attention. And you have
just pausing that there. This was an important point with regards to the heart valves. And I remember when I had seen those statistics, I immediately went to look. And the tricuspid valve does seem as though it's primarily affected. And the tricuspid valve connects the right side of the heart. So blood coming from the legs and the brain and so on, get into the right side of the heart, it's pumped through the lungs and then comes through the left side of the heart. So the right side of the heart is being primarily affected with regards to tricuspid regurgitation, where the blood is going back through the valve. And I thought at the time that this was probably related to increased pressures in the pulmonary arteries and not necessarily valve damage, just higher pressures, which eventually then caused these valves to leak. That was my thought at the time. I thought I'd drop that in. Let's continue to listen.
British NHS numbers, newborns to 1 year old, again, valve disorders, 2025, skyrocketing, aortic and tricuspid valves, again here. So this is not an isolated phenomenon. It's showing up in multiple countries in the medical databases of your own hospitals. Then, of course, the normal problems we see here, immune cell infiltration into the myocardial tissue after vaccination, very well documented. In a lot of pathological findings, you can see this here. This infiltration is, of course, an inflammatory damage that is a consequence of the exposure to spike protein and or inflammatory causing agents. Then we have the same also with the virus. And actually, Omicron is worse in that respect than Delta. You can see here, Delta in the histology score of different aspects, edema, immune cell infiltration, cardiomyocyte degeneration, and necrosis, is having a much, much larger impact on the heart than all the other previous strains.
This is a huge point that is being made here. And this is something that I don't think people fully understand, is that based on that research, Omicron is so silent, such mild presentation in terms of lung disease, that people underestimate it. It seems to be neurotropic, affects the brain, and based on this research here, seems to target the heart. And this would fit with the pattern that I had shown with regards to myocarditis rising. And just so in case you've missed it, this is a really, really important principle with regards to what's happening with acute myocarditis. This is what it looks like here. As I said, it's starting to accelerate into 2025 because Omicron is still circulating. This is a perfect description of the COVID storm, where virus circulating in an immune primed population. And so this is critical point for us to understand and to get some grasp of. Let's hear a little bit more from Joachim.
So again, a call to think about Omicron's mildness. In some aspects, Omicron is anything but mild. So what did we do in 2020? We started already in preclinical trials in Asia, and we looked at this infiltration problem, and we were able with some dietary supplements to significantly reduce the immune cell infiltration and the resulting troponin levels in animal tests. And then we continued at the same lab in 2022, the first trials where we wanted to see the distribution of spike protein in animals, and we injected those intraperitoneal into the animals, and after 72 hours you see a complete distribution in the animal, and over a few days it goes down, and we tried several binders. So these were our first steps in trying to mitigate spikeopathy in a way. But now another really mind-blowing finding, and it was, to my shame, I have to say, I overlooked a paper, because we were discussing now over the past years, how long can spike protein circulate itself? So once it's in the bloodstream, how long does it take to disappear? That's an important information. And so we thought, and I thought, 72 hours, maybe a few days. Yeah. But now I found this paper. They injected S1 subunit spike into mice, and then they measured how long it would take for the spike protein to be absorbed by the tissue, the peripheral tissues, no matter where. Endothelium, brain, all the organs. And it was taken up in less than 10 minutes. So that means if we find spike protein in a blood sample in larger amounts, and it is being taken up by the surrounding tissue at this speed, that means we must have an enormous replenishing at any given moment. Yeah, so that is another real interesting factor that nobody has really taken into account when they talk about spike persistence. It has such an affinity to bind that it disappears, let's say, maximum half an hour, it's gone. Yeah? Okay, and as this is happening mainly in the vasculature, we should now look at what happens in the vasculature in more detail. I will not go too deep, and we might go quicker over the slides, but our vascular system has an inside coating. It's called the glycocalyx. It looks like a carpet of very thin fibers, and that ensures that the endothelium is protected. The next layer, you'll see the endothelium here in this part, and the blood flow and the whole hydrodynamics of the blood are being maintained in a beneficial way for us. And here's some papers that were looking at the glycocalyx, and they could state that an intact glycocalyx, so this layer here being intact, acts as a barrier preventing the virus and even lipid nanoparticles from binding to the epithelium. So that is one of the most important protective mechanisms we have in our organism, is an intact glycocalyx. And what do we see in COVID-19 patients? In the hospitalized, in the convalescent patients, we see a strong degradation and damage to the glycocalyx. So that means once the virus enters and starts to set foot into our organism, it does more damage. Omicron itself can bind excellent to these little fibers that are on this glycocalyx. And so a constant presence of spike protein will sooner or later start to degrade your glycocalyx. Very clearly documented.
I cannot emphasize just how important this point is with regards to the glycocalyx. And I think Joachim was one of those who really focused on this glycocalyx. And I think that it was absolutely critical point. And so just a few slides here to emphasize this, because this is related to the upcoming presentation. If you're not aware, join me, the Rising Heart Crisis. These are all relevant to why these things are increasing, because it's one thing to say that they are increasing. The next question is why. And here is just a reminder as to how this works and what exactly happens. And you can see here that this is an artery. And what you have to note is that on the inside of the artery, it's extremely smooth. Any kind of exposure of the endothelial cells will trigger the formation of clots. And this is considered to be damage. And so this is like perfect glass on the inside. And just as he had mentioned before, this glycocalyx, as he said, is perfect description. It's like a carpet sitting on top of the endothelial cells here. So these are the endothelial cells down here, and they have this forest of glycocalyx on top. And if this is getting damaged, it means that the exposure of the endothelium to the spike protein or otherwise is far greater. It's doing a similar job as in the airways with mucus. So you can almost think of the glycocalyx here as a mucus layer that is causing or protecting the endothelium from being damaged from stuff in the bloodstream. So it's a very, very important part of the system. And my description for what I have as an analogy is like, if when you have damage to this endothelium, it's like having the potholes. And what happens over time is that the potholes get bigger as more and more rain falls, and it increases the chances of damage to cars driving on the road and just damage to the road itself. And if this is not addressed, it only gets worse. So the glycocalyx represents the asphalt on the surface, perfect and smooth. When that gets damaged and you start to break through this surface, you then get down to the on the surface of the road, and if left, it will only cause damage to the road and to the vehicles on it. And with that in mind, it explains why we see this unusual pattern where one of the most significant rises of damage in terms of the cardiovascular impact here is to do with essential hypertension. This is the trajectory flattened before, and then it just goes off. This is probably one of the highest rises in terms of the of conditions in the cardiovascular patterns. A continued rise just keeps on rising way beyond the baseline here from 2015 to 2019. So when we look and understand that principle of the glycocalyx, you realize why this is such an essential point. I'll pause here. I'll be playing other clips with Joachim at different points over the next few weeks and so on. But this is just to highlight again why we are seeing these patterns. And I'll be covering more of these points, not just hypertension, but the myocarditis, the heart blocks, all of these things that are very relevant to how disease is presenting at the moment. And the better you understand this, at least you can then stand in the gap for those relatives who are struggling and have no idea what is going on. Remember, when you're talking about it, you're better off, depending on who they are, is presenting the concept of the storm, meaning that if you just focus on this, they will close down. If they have been vaccinated and you tell them this is a problem, they'll just not think about it. However, if you can get across the fact that COVID infection occurring in an environment where your immune system is already primed may cause different kinds of immunological changes leading to damage. That's far easier for people to digest and to accept. And I think that this is what we have to do now, is learn how to get information across that is relevant, because at this point, people are either vaccinated or unvaccinated. There doesn't seem to be any other middle ground. And so what you want to do is not necessarily get people frightened about what is happening, but you want to emphasize to them that this may be the pattern. And if it is, there are likely to be ways to mitigate against it. And that's what's valuable with regards to getting rid of the spike protein. My personal approach is usually to address any underlying inflammatory processes, try and address that first, and then you clear, because otherwise it gets harder to get rid of spike protein out of the system. But we have lots more to learn, lots more to share. We'll continue to give you information. Just continue to hang on to the science and stay with us as we try and put it all together. Have a great evening.